अस्सलाम वालेकुम, मैं हूं महनाज अकबर अजीज लाइफ टॉक्स के साथ। दुनिया में नज़र दौड़ाई जाए तो इमिग्रेंट पाकिस्तानीज के बच्चे जो हैं वो बहुत बेहतर कर रहे हैं। वो हर किस्म के सब्जेक्ट में, हर किस्म के एरिया में दे आर डूइंग वेरी वेल। क्योंकि एक वजह ये है कि उनको मेरिट बेस्ड मौके मिलते हैं। दूसरी वजह ये है कि उनको एक ऐसी इन्वायरमेंट मिलती है जहाँ वो फल फूल सकते हैं। एजुकेशन सिस्टम बहुत बेहतरीन होता है। हाँ, ये बहुत मुश्किल है कि वो अपने मुल्क से दूर जाते हैं और फिर वहाँ पर एक जो जड़ से पौधा निकला हुआ होता है उसको दोबारा से वहाँ पर लगाया जाता है और फिर वो फलता फूलता है। पहले पहले जब देखा जाए 1970s और 1980s में, तो ज़्यादातर पाकिस्तानी डॉक्टर्स बाहर गए, ज़्यादातर पाकिस्तानी बिजनेस क्लास, लेबर क्लास बाहर गए, और अमेरिका में तो डॉक्टर्स ज़्यादा गए। लेकिन जो अब वहाँ पर पाकिस्तानी इमिग्रेंट्स के बच्चे आगे बढ़ रहे हैं वो मुख्तलिफ किस्म के सब्जेक्ट्स में आगे बढ़ रहे हैं। आज मैं आपको एक बहुत इम्प्रेसिव और बहुत ख़ास एकेडमिक से मिलवाऊंगी, और रियली प्राउड दैट शी इज़ एन असिस्टेंट प्रोफेसर ऑफ यूनिवर्सिटी ऑफ मिशिगन एन आर्बर, और वो सोशियोलॉजी के डिपार्टमेंट में है। Nafeesa Andrabi's research broadly focuses on how and why race, religion, and nativity intersect to shape stress and health outcomes among Muslims in America. She is currently studying the relationship between socio-political stress and adverse reproductive health outcomes among Muslim immigrants. बहुत ही important topic है क्योंकि health के जरिए लोग बहुत मार खा जाते हैं, और ख़ास तौर पे जो इमिग्रेंट्स होते हैं और जो रेस, एथनिसिटी, रिलीजन की वजह से, ये तो हमने कभी स्टडी किया ही नहीं, जो नफीसा अपनी रिसर्च से आगे ला रही हैं, और ख़ास तौर पे अमेरिकन मुस्लिम्स के लिए। और ये पाकिस्तानी मुस्लिम्स नहीं, अमेरिकन मुस्लिम्स हैं जो मिडल ईस्टर्न कंट्रीज से भी हैं, मीना रीजन से भी हैं। अच्छा, और नफीसा ने पीएचडी की फ्रॉम यूनिवर्सिटी ऑफ नॉर्थ कैरोलिना एट चैपल हिल इन 2024 और सोशियोलॉजी में की थी। पोस्ट डॉक्टरल कंप्लीट किया है फेलोशिप एट यूनिवर्सिटी ऑफ सदर्न कैलिफोर्निया केक स्कूल ऑफ मेडिसिन से। बहुत ही काबिल हैं और बहुत ही यंग एज में अपना पीएचडी कंप्लीट किया और असिस्टेंट प्रोफेसर अब लग गई हैं। We'd be very interested to know about your research on reproductive disparities. So, where did it come from? How did you, think of working on that?
Thanks for having me. I'm a sociologist and a social demographer, which broadly means that I think about how society is structured and how people can flourish or not flourish under the sort of structures of society. And I mostly focus my work right now on the US. I came into sociology and demography in part because I was thinking a lot in college about the ways in which I was seeing higher and higher rates of poor health outcomes among people in my own family. So people were being diagnosed with things like diabetes and cardiovascular disease at really young ages. And as I came into sociology and medical sociology specifically, we learned a lot about how social stress and sort of the environment around one that one grows up in, the sort of people's migratory paths, people's experiences over generations, things like colonization, things like experiencing partition, how those can actually sort of lodge themselves in the body, get under the skin in what we call sort of epigenetics, which is a growing subfield within sort of social epidemiology, sociology, and population health. And so I really was curious to understand why my community, why my family, why people who I was surrounded around were being diagnosed with these kinds of illnesses at earlier and earlier ages. And so I sort of started doing stress research that was sort of focusing on understanding some of those mechanisms. But I really kind of started thinking like a social scientist at a much younger age. So my dad is an economist. He is a development economist who's worked on education in Pakistan for a long time. And both my mom and dad are really sort of involved in their communities and involved in sort of trying to recognize how we can sort of support the people who are around us, kind of trying to understand how people's lived experiences really shape their trajectories across their lives. And so from a pretty young age, I was encouraged to think like a social scientist, to sort of notice and perceive things that were happening in the world around me. I grew up back and forth between California and Pakistan. And in California, I grew up in a really, sort of hippie, small college town with liberal arts colleges. And I went to a public school where we had, drum circles and got to make up our own homework. And then coming to Pakistan and sort of, seeing a lot of visceral poverty and inequality, and then going back to California and being embedded in a really different environment. So I think I was really picking up on and seeing different social realities around me from a really young age. And both my parents really encouraged my siblings and I to sort of notice those, observe those, name them, and then recognize that we were kind of part of this generation that was pretty well resourced and educated and had the tools at our disposal to like really make careers out of asking these questions and trying to solve these kinds of problems. And so I was encouraged to kind of, think about what it was like to do more work that was more social impact focused, work that was really kind of noticing the problems around me and thinking about how we could solve them. And research really became an exciting avenue for me to do that, where, all I had to do was ask questions that were interesting to me that I felt like people should be thinking about, and then figure out how was I going to answer those questions through different kinds of rigorous studies, whether they were studies that were happening in the lab, or whether I was, collecting large data out in the field, or whether I was using data from the US Census. And so, all of those kind of experiences kind of came together, and I think have really sort of led to the culmination of what is now, I guess, my career as a research scientist, as a sociologist, as a professor, and as an academic kind of more broadly.
Nafeesa, what I have seen in some families of immigrant Pakistanis, they try to immerse themselves in the culture that they go and settle in, or the society they go and settle in, because it is unsettling to be, coming from outside and the way of things, and then, you are picked at in the school. लोग तंग करते हैं, बच्चे तंग करते हैं, दूसरी माएँ जो होती हैं वो मुख्तलिफ अंदाज में देखती हैं. So I gather that in your household you were celebrating the diversity of your own origin and where you lived, Claremont colleges, Pomona colleges, so where you lived. So is that so? Tell me some interesting stories about that.
Yeah, I mean, I think something that my parents did a really great job of, and I think now, I study immigrants academically, so I know there's lots of different kinds of migration pathways, right? So I have parents who, my dad came to the US for the first time for college, which is a really particular migratory experience, right? My parents did not come to the US as political refugees or seeking asylum. They came under a very particular set of circumstances that allowed them to integrate in the 80s in the US context in a really particular way. And I think that, I think it's sort of important to note and name that, of course, because there's, such a range of migratory experiences that people have. There was also sort of a generation of people, like you said, of who migrate to the US or who migrate to other contexts and who really try to assimilate. And, whether that means really, when you've left your home country saying we've left it, we don't want to have anything to do with it. We're now in this new place and we're going to try to become for example, as American as we possibly can be, which often meant not teaching their kids sort of their native language, and really trying to emphasize being as integrated as possible into the US. And I think in my family, my parents really encouraged us. We only spoke in Urdu at home growing up, which was really helpful, ताकि जब फिर बड़े हुए हम यहाँ स्कूल आ सके, मतलब रिश्तेदारों के साथ मुलाकात कर सके. We were able to sort of come back and forth with a lot of fluidity and ease. We didn't feel as outside when we were here. We've been able to come independently. And they did really encourage us to sort of own our, being Pakistani, being Muslim, all of those things. But I think it was often hard. I mean, I was such a brat with my mom when I was a kid, and she would say, dinner table pe hum sirf Urdu mein bolte hain. I'd be like, nahi, main kahani sunane ki koshish kar rahi hu. I'm like trying to tell you some hot gossip from junior high, and I don't want to figure out how to say it in Urdu. But she would really insist, and she would say, nahi, ye Urdu mein bolna hai table pe, aur hum sirf Urdu mein bolte hain ghar mein. And it was, she really held fast to that. And we were really bratty, teenagers and didn't always want to sort of follow that rule at home. But in retrospect, looking back, I'm so grateful to have language. And then, Abu would really encourage us to read Shairi with him. And so I would sort of practice reading Urdu, even though my reading Urdu is quite kamzor, but I would read with him, and, they would find ways and opportunities for us to be as integrated as possible. When you walk into our home, it looks like being in a mini Pakistan, but in the most sort of beautiful way possible. But it certainly wasn't always easy, because we were here in Pakistan for a few years when I was in elementary school, and we moved back to the US just a few months before 9/11 happened, which for me at the time, I was 10, 11 years old. So that's a kind of a rough life stage. You're like entering adolescence, you're about to be a teenager, you're becoming much more perceptive about the world around you, you're learning how people see you, you're thinking a lot about those kinds of social dynamics. And so I think that was a really hard time for me to come back into the US. And certainly Amma and Abu tried to make it as easy as possible for us to celebrate our full selves and be our full selves. But I think I really struggled for a long time through junior high and through high school to really reconcile those multiple identities. And as I've gotten older, as I sort of moved through college and graduate school and various jobs, I've become much better at sort of integrating all those different parts of myself. And I've, of course, sort of having a supportive space at home where my parents have really always tried to encourage and also really modeled what it looks like to have a foot in both countries and a foot in both cultures, and showing us that we don't actually have to, shirk one or the other, and that we can sort of figure out how to do both and hold both, although it is often, challenging, and it is, often uncomfortable. But I think they really raised my siblings and I to sort of lean into that discomfort and say that, no, it's really worth it to figure out how to carve an identity and a career and a sense of self that really celebrates all parts of you.
So you mentioned a foot in both the countries. And here I would say that not just a foot walking, but a foot climbing. Dr. Nafeesa is a mountaineer, she's a skier. She was the ambassador of North Face, the sports brand as well. And she has scaled many mountains and many trails here. And the journey started with none other than a beautiful place in Gilgit called Shamshal. And I would really like you to mention that, Nafeesa, about your experiences in the mountains in the northern areas of Pakistan.
Yeah. So, I grew up in the foothills of California. So my parents really encouraged all of us. We would go camping, we would go swimming in the ocean, and we had a real love for the outdoors. My Abu and my Dada grew up in Kashmir and also sort of around these sort of really beautiful mountainous towns, and would always tell us stories about the rivers of Punch, and Abu learned how to swim, in the rivers here in Pakistan. And so we sort of always had a lot of these stories in our imagination. And, of course, my mom also was really insistent growing up that we, especially her daughters, have sort of access to doing as many sports and activities as we possibly, could want. And she felt really strongly that we should be both well-rounded, but also, that we should be able to, seek out sports and seek out whatever kinds of adventures we wanted. And so when I was 16, when I was 17, for my high school graduation, I asked that I be able to come to Pakistan and do this multi-week trek to Shamshal. So this is back in 2007, the summer of 2007. And Amma and Abu were in the US. They sent me to Pakistan. They said, okay, go. They didn't ask too many questions. I was completely off the grid for a couple of weeks. And I think a lot of credit goes to them, where they really, even if they ever felt anxious about what I was doing, they certainly didn't let it show and were really supportive of me, carving out whatever path. And it was an atypical present for a 17-year-old to ask for, but that's what I wanted. And I had an incredible experience. And Shamshal really became this, just like a magical place at that time. The Chinese hadn't come and fixed up the KKH yet. So it was a pretty chaotic experience getting there. And we were, yeah, there's just something about moving my body outside in these beautiful areas for 12 hours a day that I
Nafeesa,
just
tell
love.
me that how safe is it for a 17-year-old, not Pakistani origin, but any other nationality, to come to the northern areas of Pakistan and do the trekking? What is the system around it? What are the challenges around it?
Yeah, I mean, I get asked questions around safety in Pakistan a lot, even this morning when I was out hiking by myself in the Margalla Hills. And I was just having a conversation with my sister. We were out for a walk in the afternoon around F8. And, you know, I think that there's norms, certainly there's norms around what women do and what women can do or should do in outdoor spaces. And sometimes those norms have to be challenged. And I think there's a narrative around safety that, you know, there's some risk. There's some risk of, obviously, we've seen gender-based violence in Pakistan. There's certainly risk. But I think there's also has to be a generation of people that are really pushing back and challenging those norms, because norms have to shift somehow, right? And like the culture has to shift somehow, and people are a key part of how culture is created and co-created and recreated. And so, you know, I've been really lucky. There's such a generation of women in Pakistan and across the globe who are really saying like, no, we belong in these spaces and we deserve access to these spaces and we're going to be in these spaces. And I think for the most part, people adapt. Even when I'm walking around F8 saying I'm going to walk to the coffee shop, you know, people adapt, and it's actually much less weird and uncomfortable than one would think. I hike regularly in the Margalla Hills by myself, and I don't try to be naive about it by any means, but I certainly think that people have to be willing to sort of embrace a little bit of discomfort in order to sort of show and demonstrate and model what this culture could look like. I mean, Islamabad has access to amazing mountains, and certainly when you're on the trails, you realize actually there's so many people enjoying those mountains. Same with when you go into the northern areas. Of course, they're really used to having, you know, well before there was domestic tourism, there was international tourism, Europeans coming to sort of climb and ski in some of these mountains. And so they're really used to it. They love to have people enjoying these spaces. And I think that like we all have to sort of lean into that discomfort a little bit and sort of move away from this safety narrative.
So since you mentioned skiing, you did a workshop in the Naltar area with local girls who were not like in the business of skiing, but had learned it from either being a part of an entourage or something like that. So you brought in gear for them, and tell us about that, about empowering women skiers from Hunza.
Yeah, so I came into skiing in the US. It's a super white sport. It's a super male sport. And over the last several years in the US, there's been a lot of push to sort of diversify what skiing looks like. And for me, I was like, yeah, I want to diversify what skiing looks like in the US, but really what I want to do is I want to be able to ski in my home mountains in Pakistan, and I want to be able to ski with other Pakistani women. And you know, that's what sort of really feels, and here when I was in Shimshal, even as a 17-year-old, that very first time I went trekking, it was one of the only times that I just didn't question who I was and what I was doing out on the trails, because yeah, mountain sports in the US are really white and they're really male dominated. And it felt really special to be able to have time and space in the mountains here when I was 17, where I felt like I really belonged. And where all the people that I was with, all of my Shimshali friends really helped me to feel like I belonged. And so when I joined the North Face in the sort of athlete development program, we had access to funds. We could pitch a project. It could be a personal project, like you want to go ski or climb something and you want to make a small film about it. But for me, I definitely feel like I'm in this position where I have access to a certain set of resources, and I think a big part of my role is to redistribute those resources, especially I feel like I have an overwhelming access to resources. And so when I came into this role with the North Face, I knew that what I really wanted to do was I wanted to sort of funnel some of those resources and some of the skill and some of the gear to people here in Pakistan, where often that access is much more difficult. And I also wanted to try to create a generation of women, or sort of create a community of women who could backcountry ski safely with each other, who could be each other's teammates and friends, so that we could sort of start moving towards being able to recreate and push ourselves in sports together here in Pakistan. So that was a big sort of impetus for that project. I contacted a bunch of brands that I knew in the U.S. Through some of my own relationships with people in the ski and the outdoor industry, and got amazing gear donations, which I then had to figure out how to fly with 800 pounds of gear. And then camp was amazing. We were settled up at 12,000 feet, set up a base camp. We were skiing every day. We were trying new things. We really worked on creating a safe space where people can feel comfortable enough to try something new, can feel comfortable enough to fall, or be uncomfortable and do something that's hard and where they might fail. And it was just a really incredible, beautiful experience. And I really hope to sort of continue doing that and continue being a part of creating those sorts of spaces.
And Gilgit-Baltistan has some stellar women in the sports, in various fields of sports. I'll steer back to your academics. So you do very important work about the health of women, the health of marginalized people, and how it has consequences, generational consequences. You've met with people here, they're working in various sectors, health sector. You've met people here working in the health sector, especially population. Can you connect the two, or your work to the Pakistani situation, or learning from Pakistan to the US situation?
Yeah, so some of my more recent research in the US has focused on looking at Muslim immigrant women and trying to understand what their poor birth outcomes are, sort of establishing some baseline facts. We look at things like low birth weight and preterm birth, which are things that can then track across the life course, and in general are also reflective of high levels of maternal stress. And so in the US, a lot of the work has focused on Black and Latina immigrant mothers, and has shown that when you experience various kinds of sociopolitical stress, like an ICE raid or sort of immigration deportation, which is not unlike what's happening to the Afghan mothers here in Islamabad, or when you experience different kinds of sociopolitical distress, right? I mean, right now we're seeing ICE in the US splitting families apart, or, which is no different than people in Balochistan being disappeared for various kinds of political reasons, or people in the US, Muslim immigrants especially, are really being targeted, and their lives are being made really difficult when they participate in various kinds of pro-Palestinian activism. And we see how activism in Pakistan is also, can lead to sort of people's lives being really being made really difficult. And so I think there's lots of different kinds of connections, right? I mean, I study the groups that are marginalized in the US, but there are groups that are marginalized in Pakistan who likely have much higher levels of stress and stress-related health disparities than other groups. I study also sort of why we have these health disparities, right? So is it structural? Is it systemic? In the US, we think a lot about racism, but here in Pakistan, we can think about different kinds of systems that make it so that some groups have way more access to resources than others. And then the other big thing in my research right now is I find that among Muslim immigrant mothers, which is looking at mothers who are from the Middle East, from South Asia, and from Africa, I find that South Asian Muslim immigrant mothers have quite poor birth outcomes, which is often surprising. Many of them are migrating with sort of higher socioeconomic status, and yet they have higher rates of low birth weight and preterm birth. And this is perplexing, right? I mean, some of it is this something that's happening in their country of origin, right? Experiences from their country of origin that they're then sort of bringing with them. What is it that's contributing to this like quite poor maternal health, even once they're in the US? And some of that finding is somewhat surprising. And so part of what I'm trying to do now is really understand, like, is it something that's happening to them once they come into the US? Or is there something that's happening, for example, in Pakistan and to some extent in Bangladesh, that's sort of contributing to what then is sort of physiologically is happening to them once they migrate into the US? And so sort of starting to understand then what are the rates of preterm birth and low birth weight here in Pakistan? How are those comparable to the rates of low birth weight and preterm birth to the mothers who are then have immigrated to the US? And then I also, in some of my conversations around the folks who are doing population research here. I also look a lot at, reproductive health, but also contraception and family planning and female autonomy and agency. And so that's been a big conversation here, right? What does it mean for women to, we have a really high fertility rate. We have, there's lots of different things happening with people's access to contraception, with people's access to...
Population is a big concern here.
Yeah.
Nafeesa, do you eat biryani with your hands? You know where I'm getting at?
Yes. Nahi, roti ke saath. But actually what I do is what I've heard is the more Kashmiri thing to do, which is haath se bhi khana hai, lekin roti ko phir chawal
What do you think
khao.
about Mamdani and Mamdani being the mayor of New York?
Yeah.
As the younger generation of Pakistani immigrants, how do you see Mamdani, the mayor of New York?
Yeah, I mean, Zohran Mamdani's election has been so exciting and energizing, especially for those of us who are involved in American politics, who care about American politics, who are impacted by it. It's not the end all be all, of course. There's many countries beyond America, but for those of us who are living there, especially in the last couple of elections, in this last election, I think for many of us, especially Muslim immigrants in the US, Pakistani immigrants, many of us were involved and cared deeply about the Palestinian cause. We cared deeply about the lives and the livelihood of immigrants in the US. And we saw that, the last election really, really was a heartbreaking election to sort of experience and be a part of. And we've seen time and time again, especially for me, basically since I've been of voting age, of seeing progressive policies really being stamped out of the Democratic platform. So for me to see someone who is, Zohran, who's so multicultural, who, is speaking and doing these videos in Urdu, and then is going to the masjid, and then is, eating biryani from the cart with his hands, and then, but is also celebrating the arts and is also just like such a joyful person who's really representing the kind of politics that we want to see, and then is really standing firm with integrity on his progressive platform, right? On affordability, on making sure, so many of these things that we care about, of making sure that everybody has access to healthcare, of making sure that everybody has access to safe transportation, that everybody has access to homes and safe places to live. And so to see him really get to, come into the public space and the public eye and to win the election.
And also a lot of his team is Pakistan. His young team is from Pakistani origin.
Well, yeah, I mean, Lina Khan, who's been this like amazing, was an amazing force. She's a lawyer, and she's really been trying to take down a lot of the sort of conglomeration of these large companies like Google and Meta, Facebook. So she's a part of his transition team. And his transition team, it's not just Pakistani origin, but it's lots of different people. Like people from really diverse backgrounds, certainly lots of immigrants, certainly people who are really reflective of the kind of city, obviously, that New York is, but also the country that the US is. So I think he's really, doing service to what we might have sort of idealistically called the melting pot of America. It certainly hasn't felt that way in recent generations, but I think that he's really sort of highlighting and bringing that to the forefront.
Thank you so much, Nafeesa Andrabi. And my last question is that what advice do you have for the younger generation, and especially children of Pakistani immigrants or any other nationality? Where should they go? What should they do? And what are the lessons from your life? Yeah,
I think a big one is probably leaning into discomfort and being okay sort of doing things that are a little bit not by the book. I think that I've had various chapters of my life that are fairly non-traditional, and I've been really lucky to have a family that's very supportive of it. So I think for parents of children, I think really being supportive and giving a safe landing space to your kids when they try out different kinds of career paths and adventures and then need a sort of a place to come home to and recalibrate. I think for me, I think really sort of knowing that I'm part of the generation that like we get to take risks, right? I grew up resourced enough where I get to really think about, well, what does it mean for me to work, not just to make a living, but work to sort of put my values into practice, right? If I have to live within a system where I have to work 45 hours a week or more, then I want that work to be something that really is deeply fulfilling and meaningful and which really which really puts back, gives back to the society that I've benefited from, that gives back to the communities that have raised me and been an integral part of my life. I think being willing to sort of take some risks, and I think being willing to really insist on living a life that is fulfilling and meaningful for you, because inshallah, all of our lives are long. And I think we owe it to ourselves to create lives and sort of take the opportunities that are given to us to sort of live the most meaningful and impactful lives that we can. So I really hope that everyone, can really channel into that. And that it's not always easy, it's not always comfortable, but I think that in the long run, it's worth it.
Thank you so much, Dr. Nafeesa Andrabi. And you're a star. You're a star, and you make Pakistan so, so proud. You make your parents proud, and you really make us all proud, as we know that being the associate professor at University of Michigan, Ann Arbor, is very special. It's a really great institution, and to see professors of Pakistani origin being there is like amazing, and especially the work that you're doing with the marginalized communities and the connectivity that you have maintained with Pakistan and the positives of Pakistan. The stories that you are telling are the positive stories of Pakistan. Thank you so much. Pakistan Hamesha Zindabad.